So my video was stopped inadvertently. I was saying that you do not see any facet for costal facet on the posterolateral aspect of even the first lumbar vertebra. Now coming to the parts of a vertebra, and that is true for any region of the vertebral column, be it cervical, thoracic, or lumbar. In general, what we say is a vertebra carries this part. This is called as the body, the largest part of the vertebra. Then from the body, these parts which are extending posteriorly and laterally, these are called as the pedicles. Then from the pedicle, this part which extends posteriorly and medially, these are the laminae. Singular is lamina. This is the right lamina, this is the left lamina, and these two fuse together. Right, so this is the vertebral arch formed of the pedicle, lamina, pedicle. Right, and from the vertebral arch, seven processes are attached and they extend in various directions. Now, in this superior view, you can see there is a pair of processes extending backwards and laterally. These are called as the transverse processes. And there is a single unpaired process which is extending posteriorly from the junction of the two laminae. That is known as the this is known as the spinous process. Right. Then, if I give a lateral view, you can see that from the pediculolaminar junction, let me just focus this thing. Yes, from the pediculolaminar junction, there is one this process, and there is another one is this process. These are the two superior articular processes. This is actually an ossified ligament. Let me pick up another lumbar vertebra. Uh, this one here, you can more easily see this is the left transverse process, this is the right transverse process. These two are the superior articular processes. This is the left superior articular process, this is the right superior articular process. And then inferiorly also we have the left inferior articular process and the right inferior articular process. Right, so from the vertebral arch we have two transverse processes extending laterally mostly and slightly posteriorly also. We have a single spinous process extending posteriorly. We have two superior articular processes extending superiorly, and we have two inferior articular processes extending inferiorly. So these parts of a vertebra are present in all the regions. If I pick up a cervical vertebra also, we will see that this is the body. Right, then from the body, these are the pedicles extending posteriorly and laterally. These are the laminae extending posteriorly and medially. This is the spinous process, this is the transverse process. Then on the lateral view we can see that this is the superior articular process and this is the inferior articular process on the other side also. Same if I go for a thoracic vertebra also. How do I identify? This is a thoracic vertebra. There are presence of these costal facets. But we see that even thoracic vertebrae have these transverse processes. One is this one, the other is this one. We have a spinous process also. Then we have these two superior articular processes also, and then we have the inferior articular processes also. Note that coming back to the lumbar vertebra, note that the superior articular processes, they bear these facets on their posterior and lateral surfaces. These are called as the superior articular facets. They are facing posteriorly and medially. And the inferior articular processes also bear these articular facets called as inferior articular facets. They are extending in which direction? If I look at the vertebra from the anterior view, they are extending anteriorly and slightly laterally. What is their function? If I pick up another lumbar vertebra, if this was the L1 and this is L2, and if I just articulate these two vertebrae, so the inferior articular facets of the upper vertebra. If I just place it here, you can see that a joint is formed between the inferior articular facet of the upper vertebra and between the superior articular facet of the lower vertebra. So intervertebral synovial joints, which are also called as zygapophyseal joints, they are formed between the inferior articular facet of the superjacent vertebra or the vertebra lying above and between the superior articular facet of the subjacent vertebra or the vertebra lying below. Now, these are not the only intervertebral joints which are present. There is another kind of intervertebral joint which is a cartilaginous, because the bodies of the two vertebrae are separated by something called as intervertebral discs, which can be shown here. This area is formed by an intervertebral disc. This we know is a secondary cartilaginous joint made up of fibrocartilage. Right? Okay. So now coming to the specific features of lumbar vertebrae. Now, if we compare the lumbar vertebrae to the thoracic and the cervical vertebrae, we will see that the size of their body is the largest. So we will say that the body is largest out of cervical, thoracic and lumbar vertebrae, and the shape of the body is, it is kidney shaped or reniform. We can see that the bodies of thoracic vertebrae are comparatively heart shaped or more or less triangular, whereas the bodies of lumbar vertebrae are reniform or kidney shaped, more have a greater transverse diameter, and the anteroposterior diameter is comparatively shorter. Right, then their pedicles, they are attached to the upper part of posterolateral part of the body. They emerge from upper part of posterolateral part of body, and they are directed more or less posteriorly. However, as we go down the vertebral this lumbar vertebrae, what we will see is the direction of the pedicles is going slightly backwards and slightly laterally also. So the pedicles are directed backwards, and in the L1 vertebra, here we can see they are directed almost postero-medially. However, as we go downwards, their direction changes and goes towards postero-laterally. Right. Then, if we have a look at the articular processes, the superior and the inferior articular process, we can see that there is, let me just decrease the exposure of this thing. Yes, this is much better now. Lock it here. Yeah. Now, if we see that the distance between superior articular processes is greater than the distance between the inferior articular processes. However, as we go down the lumbar spine, L2, L3, L4, and L5, L5, in L5, the distance between the superior and the inferior articular processes is the same, or sometimes the inferior articular processes can even be wider apart than the superior articular processes. Right? So, that is a characteristic feature of the fifth lumbar vertebra. Now, I will tell you that the first four lumbar vertebrae, 1, 2, 3, and 4, they are called as typical lumbar vertebrae, whereas the fifth lumbar vertebra is called as an atypical vertebra. In every region, cervical, thoracic, as well as lumbar, we have most of the vertebrae are typical, but there are some vertebrae, either one or more than one, which have certain features which are different from the characteristic features of that particular region of vertebral column. In lumbar vertebrae, the fifth lumbar vertebra is the atypical one. One of its atypical features is this distance between the superior and inferior articular processes, which is almost the same. Second is, have a look at the transverse processes of all these lumbar vertebrae. They are very slender, they are small, and they are directed posteriorly and laterally. In L1 also, then in L2 also, posteriorly laterally. In L3, as we are going down the spine, their direction is more becoming more lateral and less posterior. Then in L4, almost laterally, whereas in L5 they are directed totally laterally, and they have become comparatively stouter, and they are invading on the posterolateral part of the body as well, right? So the second feature of the atypical fifth lumbar vertebra is that the transverse processes are very stout, and they are uh, encroaching upon the posterolateral part of the body. They are attached to the pedicle, but they are attached to the body as well. If we look in the other typical vertebrae, they are attached only to the pedicle. They are not attached to the body, right? Okay, so that was the second feature of the L5 or the atypical vertebra, right? Now, coming to the typical vertebrae, now I have told you we have the body. Now, the body, details of the body. Now, body has obviously a superior surface, then an anterior and lateral surfaces, and an inferior surface, and it has these ring-like borders. Right, this part will be covered by cartilage, and this will participate in formation of the secondary cartilaginous joint, fibrocartilaginous joint, and this part as well. Now you can see the curvature, this concavity of the lateral and the anterior surfaces of the body, and you see these various vascular foramina through which blood vessels enter or leave the body of the vertebra on the posterior surface of the body. If I can just increase the exposure here a little bit. Yes, lock it here. Yes, you see these foramina, these are called as the basivertebral foramina, through which blood vessels enter and some veins they come out, and they join the something called as the internal vertebral venous plexus. Right. Okay. Then you look at this triangular foramen present in the concavity of the vertebral arch. Right. I'm talking about this foramen, which is enclosed by the pedicles and the laminae on the lateral and posterior sides, and by the posterior surface of the body anteriorly. This is called as the vertebral foramen, right? And this contains either the spinal cord up to the lower level of body of L1 vertebra, and below that level the spinal cord ends, and it contains the roots of the L2, L3, L4, L5, then S1, 2, 3, 4, 5, and the coccygeal nerves. So that is called as something called as cauda equina. So the vertebral canal contains either the spinal cord or the roots of spinal nerves, plus their coverings called as the dura mater, arachnoid mater, and pia mater, and the intervening spaces. Right. So one is the vertebral foramen. So this one is the vertebral foramen. There is another thing called as the intervertebral foramen. Now, if I articulate uh, two vertebrae with each other and look at it from the lateral side, then we will see this another foramen. This foramen is called as, if I can just place it here like this, yes, and just move it anteriorly. Now this foramen is called as the intervertebral foramen. Now you can see what are the boundaries of the intervertebral foramen. Now if I again disarticulate this thing, we can see that there is, now this was the pedicle of the vertebra. Above the pedicle there is something, this is called as the superior vertebral notch, and below the pedicle there is something called as the inferior vertebral notch. We can see that the superior vertebral notch is comparatively shallower, and the inferior vertebral notch is comparatively deeper. This is in case of the lumbar vertebrae. Now if I articulate the upper vertebra with the lower one, remember that there is an intervertebral disc between the bodies of the two vertebrae also, which has been removed here, you cannot see it, but the boundaries of the intervertebral foramen are found by the inferior vertebral notch of the upper vertebra. Then there is the posterolateral part of the intervertebral disc. Then there is the superior uh, vertebral notch or the superior pedicular notch, and then there is the intervertebral joint between the inferior articular process of the upper vertebra and the superior articular process of the lower vertebra. So this is the intervertebral foramen. So there is a pair of intervertebral foramina on the left side as well and on the right side as well. What comes out of this intervertebral foramen, you can guess very well, within the vertebral canal. Now the vertebral foramina of all the vertebrae line together to form this vertebral canal, in which what is lying? There is lying the spinal cord within. This pen is representing the spinal cord that is lying within the vertebral canal formed by the vertebral foramen of all the vertebrae, just like this. And what emerges from the spinal cord? Spinal nerves. So how do spinal nerves come out of the vertebral canal? They come out through these intervertebral foramina. Here you can see through the intervertebral foramina you can see the spinal cord. The spinal nerves will emerge from the spinal cord via the this dorsal and ventral roots. The two roots unite in the region of intervertebral foramen. The spinal nerve comes out, and immediately after coming out it divides into a dorsal ramus and a ventral ramus. That will be taught to you in neuroanatomy, right? Okay, then coming back to the features of the lumbar vertebrae, then have a look at the spinous process of the lumbar vertebra and compare it with the spinous process of a thoracic vertebra and the spinous process of a cervical vertebra. Cervical vertebra ki spinous process is small and is mostly bifid, especially in the typical cervical vertebrae. Thoracic vertebra, and what is its direction? In the anatomical position, the spinous process of the cervical vertebra is pointed backwards and slightly downwards also. In case of thoracic vertebrae, the downward inclination of spinous process is highly marked. It is directed more inferiorly than posteriorly, whereas in a lumbar vertebra the spinous process is short, is more or less quadrilateral in shape, and is directed posteriorly and very slightly inferiorly. It is almost negligible. It is directed mostly posteriorly, right? So what significance does this thing have? If I come back to the articulated spine, here we can see that these are the cervical vertebrae. There is very little space between the spinous processes. These are the spinous processes of the thoracic vertebrae. They are overlapping each other. Even the laminae, which part was the lamina? These parts were the laminae. This is the left lamina, this is the right lamina, and these are the transverse processes. Even the laminae of the thoracic vertebrae are overlapping each other, and there is no space between them. However, if I come down to the lumbar spine, now this is, here you can see the characteristic shape of the spine of a lumbar vertebra. You can see there is space between the inferior border of the lamina of this vertebra and the superior border of the lamina of the lower vertebra. Through this space, what can be done is we can introduce a lumbar puncture needle which can reach where? It can reach the vertebral canal where the spinal cord is lying. Actually, we do not want to introduce a needle at the level where spinal cord is lying. Where we will go is, if this is the sacrum, this is L5, L4, L3. In the space between L3 and L4, we introduce the lumbar puncture needle. Why? Because at the level of lower level of L1, the spinal cord ends. Below the level of L1, the vertebral canal contains only the roots of spinal nerves, forming the structure resembling the tail of a horse called as cauda equina. So if we introduce a needle at the level of L1, it might injure the spinal cord, because the lowest part of spinal cord. Whereas if we introduce the needle between L3 and L4, then it will just push the roots of spinal nerves to either side, and it will not enter the root or injure any root. So that procedure is called as a lumbar puncture. So why is lumbar puncture possible in case of lumbar vertebrae? Because the spines are not overlapping and the laminae are not overlapping. There is space between the laminae. Right? Okay. Coming back to the lumbar vertebrae. Right. Then we need to know something about uh, the direction in which the superior and the inferior articular facets face, and compare it with the other regions of vertebral column. That is especially important in case of thoracic vertebrae. Have a look at this is a thoracic vertebra. Its superior articular facets are directed posteriorly and laterally. If I show you from here, they are directed posteriorly and laterally, the superior articular facets, and similarly the inferior articular facets, they are directed forwards and slightly medially. What is the significance of this thing? If I pick up two thoracic vertebrae and I articulate them with each other, you will see that the plane of articulation between the superior and inferior articular facets, this is forming the part of an arc, right? This, if this was an arc, the plane of articulation between this vertebra and the vertebra lying above it, it is forming a part of an arc. This facilitates rotation between the upper and the lower vertebrae, like this thing. I will just articulate it here and ye. This rotation can happen between the upper and the lower vertebrae. That is why the thoracic vertebral column is capable of a lot of rotational movement. However, now look at the articulation between the lumbar vertebrae. इस vertebrae के superior articular facets are directed in which direction? Posteriorly and medially. And जो उसके ऊपर वाला vertebra है, its inferior articular facets are directed forwards and laterally. So the plane of this articulation is at 90 degrees. Here, if I draw that arc, the plane of articulation is at 90 degrees to that plane. So no rotational movement can happen between adjacent vertebrae. There is no rotational movement possible. If I rotate one vertebra, the lower one will also rotate. So lumbar spine is not capable of rotating, whereas thoracic spine is capable of rotating in this arc, right? Okay. Then do we have any part gross features? Yes, there is another thing. Now if I show you a cervical vertebra, right, and compare it with a lumbar vertebra and a thoracic vertebra, what is happening is iski to transverse processes are there. Now see, now you see that this is called as the actual transverse process. ये जो आगे वाला part है, this is actually something called as the costal element, right? The costal element in cervical vertebrae is very small, and that forms the anterolateral portion or boundary of the transverse foramen. This is the true transverse process, whereas this is the costal element. What happens to the costal element in the thoracic vertebrae? It forms ribs, complete ribs. So the costal element in the thoracic region is the largest. It articulates with the body of the vertebra here, then it articulates with the transverse process of the vertebra here at the two costal facets, and then it proceeds to go like this. If I show you in the skeleton itself, here you can see that these ribs, these are actual costal elements of the thoracic vertebrae, articulating with the body, then with the transverse process, and then moving forwards. Similarly, in the lumbar vertebrae also, the transverse process which you are seeing in the lumbar vertebra is actually the remnant of the costal process. These are kind of lumbar ribs, but they are very small, and they are actually the costal elements. What happened to the actual transverse process that has shortened to this very small tubercle. This is called as the accessory tubercle. You can see it at the posteromedial surface, posteromedial end of the transverse process, right? This is the accessory tubercle. Here on this side also, on the left side, it is more prominent. This is the accessory tubercle. So the transverse process which I am holding is not the true transverse process. It represents the costal element of this lumbar vertebra, whereas the true transverse process is this accessory process. Another process is present in the lumbar vertebrae. If we'll have a look at uh, from above, we can see that this is the superior articular process of the lumbar vertebra. We can see that this rounded projection on the posterior margin of the superior articular process, this is called as the mammillary process or the mammillary tubercle. So this was the accessory process and this is the mammillary process. So this is another characteristic feature of the lumbar vertebrae. On the posterior margin of the superior articular process, we have the mammillary processes on either side. This is for attachment of a muscle called as multifidus and medial intertransverse. We will come to that later on. Right? Okay. So now uh, is there any part of the gross left? I think I've described everything. The body, the curvature between this body, the curvature, this actually represents that this vertebra is formed by the fusion of the upper somite and the lower somite. This concept of somites you must have come across in the embryology lectures as well. This curvature, this is actually a remnant of the fact that the upper part of the vertebra is derived from the upper somite and this lower part of vertebra is derived from the lower somite. Okay, right. Then we come to the attachments, the ligamentous as well as muscular attachments to various parts of the lumbar vertebrae. Now there is something called as anterior longitudinal ligament that runs along the anterior aspect of bodies of all the vertebrae, starting from the cervical vertebrae. Neck में से start होके it will go and reach up to the first sacral vertebra. That is the anterior longitudinal ligament. So where will it be attached? It will be attached to the anterior aspect of the body, especially to the upper margin and to the lower margin, right? Similarly, the posterior longitudinal ligament runs over the posterior aspect of all the bodies of the vertebrae, starting from the first cervical vertebra up to the this sacral vertebrae, right? So that is the posterior longitudinal ligament. So the longitudinal ligaments are named anterior and posterior with respect to their relation to the body of the vertebrae. Anterior longitudinal ligament will be attached here to this margin and this margin and run longitudinally, whereas posterior longitudinal ligament is attached to the posterior aspect of the body of the bodies of the vertebrae, right? Then, on either side of anterior longitudinal ligament, in case of the, if this is L5, L4, L3, L2, and L1, you can see this is L1, this is T12. Why? Because it is articulating with the 12th rib. So on the right side, the bodies of L1, 2, and 3 give attachment to something called as right crus of diaphragm, which is longer. Whereas on the left side, the bodies of L1 and L2 give attachment to something called as the left crus of diaphragm because it is shorter, so it is not attached to the third lumbar vertebra, it is attached only to the L1 and L2 vertebrae. Right? Okay. Then lateral to that, there is attachment of certain muscle. Now here you will be able to see where does the psoas muscle come from. Psoas comes from all the lumbar vertebrae and it goes in this direction downwards. Then on the medial aspect of iliacus muscle, which originates only from the iliac fossa, then iliopsoas will go down and turn posteriorly to attach on the lesser trochanter. That is why it acts as flexor of the hip joint. So psoas muscle is attached lateral to the crura to the late posterolateral aspect of bodies of all the lumbar vertebrae, then you can see between these curvatures there is attachment of tendinous arch. An arch of tendon will be attached here, then it will arch and it will attach here, then it will attach here. So those are the tendinous arches of psoas muscle. From those arches, the lateral convex part of those arches also, the psoas muscle takes origin, right? And another place from where the psoas major takes origin is, अब यहाँ से तो psoas आ ही रहा था lateral to the anterior longitudinal ligament and the crude of diaphragm, then it also originates from this part of the pedicle and the medial part of the anterior surface of transverse process as well. So psoas is coming from all this area. ठीक है. Now if we look at a lumbar vertebra closely, then we will be able to see a faint vertical ridge. It is more felt with your skin rather than seen. Let me have a look if I can. हाँ, इसमें it is visible slightly. uh, just hold on, if it is visible in any. In this one also you can see its slight presence, right? This vertical ridge is actually the separation between medial to it is the attachment of psoas major muscle, whereas lateral to it there is the attachment of a something called as quadratus lumborum muscle, and to this ridge itself is attachment of anterior layer of thoracolumbar fascia. Thoracolumbar fascia has three layers. The posterior layer is attached to the tip of spinous process. It goes laterally like this. The middle layer is attached to the tip of the transverse process. It goes laterally like this. And the anterior layer is attached to this anterior vertical ridge on the anterior surface of transverse process, and that goes laterally like this. All the three layers eventually merge with each other. You will see this better in the upcoming lecture of thoracolumbar fascia, right? So but now you know that the three layers, where are they attached? This is a very commonly asked question in the lumbar vertebrae. Posterior layer is attached to the tip of spinous process, middle layer is attached to tip of the transverse process, and anterior layer is attached to this oblique vertical ridge on the anterior surface of transverse process, right? Now as I've already told you that on the area lateral to this vertical ridge, the anterior surface of transverse process gives attachment to quadratus lumborum muscle. So quadratus lumborum muscle, now you know, lies between anterior layer of thoracolumbar fascia, which is attached to this vertical ridge, and the behind the quadratus lumborum lies the middle layer of thoracolumbar fascia, which is attached to the tip of the transverse process, right? Then which other muscles are attached? Now in this area on the posterior surface of transverse process and the posterior surface of the laminae and the lateral surface of spinous process, the muscles of back, which include erector spinae and multifidus, these are enough for you to remember. So these surfaces give attachment to the erector spinae and multifidus. Multifidus is especially attached to the mammillary process of on the posterior aspect of the superior articular facet. Then between the transverse processes, now if I articulate two lumbar vertebrae together, so between the inferior border of this transverse process and the superior border of this transverse process, there exist muscles called as intertransverse muscles. So they are attached to the adjacent borders of the transverse processes. So even this mammillary process and accessory process, they both also give attachment to something called as the medial intertransverse process, right? Then a very important attachment is, now have a look at this gap between the laminae, right? If I just place it like this, they will not. Yes. Now if I look at the gap between the laminae. So this is the superior border of
the lamina of this vertebra and the inferior border of lamina of this vertebra. This gap is closed by a ligament called as ligamentum flavum. Yellow colored ligaments, they are called as ligamentum flavum, that is singular, ligamenta flava, that is plural. So to enter the vertebral canal, a lumbar puncture needle has to pierce the ligamenta flava, right? That is the last structure that the lumbar puncture needle will pierce. If we have a look at the lateral view, if the needle is coming in this direction, first of all it will pierce the skin, then it will pierce the superficial fascia, then the deep fascia, and then it will pierce something called as the supra spinous ligament which overlies the spine, then the interspinous ligament if we are going exactly in the midline, interspinous ligament, then interspinous muscles, then it will pierce the ligamentum flavum. If I focus at this area, and then it will enter the vertebral canal. If I look at it vertically and I introduce the pen like this, here you will see that after it pierces the ligamentum flavum, now it has entered the vertebral canal to reach. Then, if we it is in the epidural space, and then subsequently, if we push it further and pierce the dura mater, then it will enter the subdural space, then through the arachnoid matter it will enter the subarachnoid space, and so on. So you should know the attachments of the ligamenta flava. Ligamenta flava are attached where? They are attached to the inferior border of the lamina of the upper vertebra and the superior border of lamina of the lower vertebra, and they close the gaps between the laminae, right? And a lumbar puncture needle has to pierce the ligamentum flavum before entering the vertebral canal, right? Okay, then any other attachments on the lumbar vertebrae? There are something called as on the tip of transverse process of the first lumbar vertebra. There is attachment of something called as arcuate ligaments, the medial arcuate ligament and lateral arcuate ligament. That those you will study when you study the diaphragm, right? Okay, and through the intervertebral foramina, you already know what emerges are the spinal nerves, and as soon as they come out of the intervertebral foramen, they divide into a ventral ramus which goes along the anterolateral body wall and a dorsal ramus which goes posteriorly to supply the muscles and skin of the back. Right. Okay. Then about the ossification of lumbar vertebrae, that I will just tell you that the body ossifies from one primary center and the vertebral arch that ossifies from two primary centers, one for each side. The posterolateral part of body, this part of the body, this ossifies from the primary center for the respective side of the arch. So most of the body is going to ossify from the primary center for the body, but the posterolateral part of body adjacent to the pedicle, that ossifies from the primary center for the respective side of the arch. So that is why neural arch term, if we use that, includes this part of the body, whereas vertebral arch term, that starts from the only the pedicle. Vertebral arch hence includes the pedicle, the lamina, and the pedicle, whereas neural arch includes this part of the body also, which has ossified from the primary center for that particular side of neural arch. Right. So the primary center for the body, which lies actually not near the superior surface but in the center of the body. This and the primary centers for the each half of the neural arch, they appear in the intrauterine life. These two unite with each other in the first year of postnatal life, whereas the ossification from this primary center and the center of primary center of the body, they unite with each other in the sixth year of life. Then there are few secondary centers also. There is one ring like epiphysis for the upper surface of the body, and then similarly for the lower surface of body. Those two are the secondary centers for the body. Then one secondary center we have for the tips of the transverse processes,
and then one secondary center we have for the tip of the spinous process, and one secondary center we have for each of the mammillary processes. So we have a total of 7 secondary centers for each lumbar vertebra, right? Okay.